Hey everyone, so today I want to talk with you about a condition called hip bursitis, or basically pain on the outside of your hip, and specifically right-sided hip bursitis. So this is a really common condition in women in their 30s, 40s, 50s who are somewhat active, and they start to get pain on the side of their right hip, usually as they're doing upright activities like hiking or running, or things like that, or even just walking. So why does this happen, first of all? So we talked about in the last video about our anatomy and how we're different right to left. So on the right side, our diaphragm is more domed because we have a liver to support it, we have a larger central tendon, we have 3 lung lobes on the right, and only 2 on the left to make space for the heart. Our diaphragm attaches lower on the spine on the right side, which helps us turn to the right. So we kind of like to center our mass over our right leg for all those reasons. A lot of times you'll see people with their right shoulder a little lower than their left. Occasionally it's different. That's another compensation. But when you're out walking or hiking or watching other runners, you'll notice that most of them kind of drop that right shoulder a little bit. That's just the normal human pattern. There's nothing wrong with that. It's only a problem when we become over-reliant on that right side, where something happens, we have a injury to our left side, we have a physical trauma, emotional trauma, we go to where we feel really safe. Or if you're really demanding a lot of your body doing continuous alternating activities like running or hiking, where you're asking both sides to work the same over and over, but because that right side feels so much more stable, it kind of gets overworked. And that right outer hip muscle, as we are in that right-sided stance position, that right hip relative to my pelvis, that right thigh bone gets turned inward. So if you can picture, if this is my hip socket, as I'm turning over my right hip, where I like to be more stable, that right hip is essentially turning inward. And that creates a lot of pressure on that right outer hip, because now that outer hip is trying to do the job of your right glute max muscle, which is that big, huge butt muscle. That glute max is kind of offline in that turned in position. And then these fibers of the gluteus medius muscle, or kind of like the side glute muscle, get overworked and they start to develop strain and discomfort. So what can be done about this? Well, the first thing to do is to give that right side a break. So even as you're running, you're doing both sides, but probably that right side is working harder, or hiking or whatever. So first thing you need to do is help your body understand how to get onto that left leg. So that's working your left inner thigh and your left back of thigh, or your left hamstring, together, sensing the floor on that left side, letting that pelvis go to the left, letting that left shoulder drop. So you would do techniques where you work that left inner thigh and left hamstring together. And I'll post one of those in a picture so you can see that. The next thing you want to do is teach that right thigh how to turn out, right? So instead of that thigh turning in or the body turning over the thigh, we want to teach that body and thigh to go the opposite way, which is like that thigh turning out. So you want to do activities that teach that right leg and thigh to turn out on a stable left leg. That means a left leg that has an inner thigh and a hamstring. So then your body starts to understand how to get out of that pattern. And yes, it's about developing strength in that glute max muscle and getting it back online, but it's mostly about letting your body know that it has another place to go than just that right side where it really likes to be stable. We're just reminding your body to get off that right side and remember how to turn that right leg out so that you can go back to the right without overdoing it, then to the left, then to the right, and then all those hip bursitis issues just go away because you're not straining that muscle because you've come back into balance. So let me know if you have any questions. You can leave me a message below or send me an email. It's Derya, Derya, at myessentialpt.com. If you found this interesting or helpful, give it a like. And yeah, thanks for tuning in.